Yeah, we are live now, ma'am. Ma'am, you can start. Ma'am, you can start.
Yeah. Hello, good afternoon. Myself, Vanita, dietitian at Chandray. Today, I'm here to share a simple discussion about the topic kidney-friendly eating pattern in lupus nephritis and vasculitis. Why did I choose this topic for discussion? Is, as you all know, 12th March 2026 was World Kidney Day, and the theme for this year was healthy kidney for all, protect the people and care for the people and protect the planet. With this same theme, I just wanted to share my inputs about how it is important to balance your protein intake, especially when it comes to kidney, how to balance the protein intake and how to balance your food pattern with reference to lupus nephritis and vasculitis. So, as you all know, lupus nephritis and vasculitis is a autoimmune condition, and basically in lupus nephritis you have the inflammation of the blood tissues because of due to SLE, and in vasculitis you have the inflammation of the blood vessels. Okay, because of which there will be a to say immune responsibility will be kind of destructed, and because of which there will be again loss of protein in the body, and the immune susceptibility also will be low in the patients. So in this condition it is very important that you balance your protein, okay, and not totally restrict your protein or avoid protein. Generally, whenever you see your kidney parameters, what I have seen in all my journey with patients is, once they are kind of known that they have some kidney impairment, they'll start restricting protein to too much of an extent, where they start fearing to eat, okay, any protein source. So here I'm just here to, today I think we need to discuss like how much is good for you and what are your choices and how to balance it, because without protein you will be losing all the other micronutrients available, also your electrolyte balance would imbalance. So it's very important that we talk a little bit about this topic. And it does not mean that once you're good on your diet, okay, there is no restriction, I mean there is no necessity to avoid your medications. I think with lupus nephritis and vasculitis it's very important that you continue your medications at all time as suggested by the doctor. So going on further, okay, why diet matters in kidney disease. Your kidney filters
Hello,
the
ma'am. Sorry
waste.
to interrupt.
Yeah,
We can't
okay.
see your presentation.
Okay, how do I do that?
Share, ma'am. Go to the share button.
Okay, yeah, yeah, one second, I got it. I think now it's fine.
Ma'am, not this one. Go for the full screen one. Just
Okay, here is it.
go for
Here.
full
Oh,
screen.
got it.
Yeah.
Okay, now it's fine.
Yeah, yes, ma'am.
Okay, fine. Sorry. Yeah. So I think the first thing is why diet matters in kidney disease. Okay, so your kidney filters. Yeah. Your kidney filters waste and the excess fluid from your blood. In lupus nephritis and vasculitis, inflamed kidneys work harder and may lose function. So nutrition therapy helps by reducing your kidney workload and preserving your remaining function, and it also helps you to prevent malnutrition from protein loss and medication side effects, and it also helps you manage complications like swelling, high blood pressure and fluid retention, and it also supports overall health while taking immunosuppressant medications. So it's not that you're supposed to avoid protein availability completely, but restrict on it so that you are keeping your good health with having a better immunity. And what are the core goals of nutrition care? Okay, preserving your kidney function and preventing malnutrition and controlling your complications. So how do we preserve our kidney function? So to reduce your protein and phosphorus load to minimize your kidney stress and slow your disease progression. This is something very essential. As I spoke in the starting of the slide, okay, protein is something which needs to be reduced. It does not need to be avoided completely. And phosphorus, again, because of the phosphate binders and all those things, the phosphorus availability going high, fluid retention will be a concern. So I think working on the phosphorus availability is also very important. In the further slides I shall discuss more about it. And prevent malnutrition is very important, because you have a good quality of protein, you can preserve your muscle mass and you can kind of maintain your immune functions better. If your immune functions are better, you'll be able to fight the infection better. So that's the reason it's very important. And I think the known complications are usually edema, blood pressure, blood sugar variations and lipid levels being higher. So I think how do we manage with a proper diet is what is essential with this. And then protein balance, I think the right equation is very important. So why is protein so much important? See, generally protein, it helps you in healing, but excess protein increases kidney workload and accelerates damage. So in your case, how much is the question? How much is important and how do you distribute it through the days? What is important? That we are going to learn further. Too little protein causes muscle wasting and weakness. The key is finding your personal balanced based on kidney function stage. So 60% of the time kidney disease patients develop malnutrition without proper protein intake. And in 30% of the people we have seen that excess protein increases kidney filtration load. So I think balance is what is essential here. And how much protein? I think here the answer is there for you. Okay, protein needs vary by kidney function stage. These are general guidelines. Always consult your nephrologist and dietitian for personalized recommendation. The moment you have the variation in your, I think, USG levels or urine microalbuminuria test and all those things, it's not directly you will stop eating protein sources. But I think discuss with your dietitian and the nephrologist and your treating doctor about what should be your portion size. It's not that totally you will avoid the protein options. When it is stage 1 and 2, it is considered as mild stage, where you will be recommended by between 0.8 to 1 gram per kg body weight. And here the quality over quantity is more important, with plant and animal sources balanced. In stage 3, that is a moderate stage, where you can have between 0.6 to 0.8 gram per kg body weight daily. More restrictive protein control while ensuring adequate calories for carbohydrates and fats too. And then stage 4 to 5, it's a severe stage. Most of the time I think clients might or patients would be requiring dialysis also. It depends from patients to patient. It is not a must, but I think they might be on dialysis. Here again the restrictions can be like, I think, 0.6 to 0.8. Again, I think based on the frequency of dialysis, again you have to have a customized meal plan by stepping up on the protein depending on the frequency of your dialysis, your muscle wastage and all those things. But the general recommended at this stage is between 0.6 to 0.8 gram per kg body weight daily or lower. Very careful protein restriction with medical supervision and possible supplementation also will be required at this stage if at all you are on dialysis. And what are your best protein choices? Okay, this is a very important thing to know. Okay, we have the plant proteins. So plant proteins are basically all kind of split lentils and whole legumes or whole lentils. And of course, I think talking about soya chunks, stuff or tofu, nuts and seeds, all these are going to be your plant protein sources. But along with plant protein sources, I think lower phosphorus, and they are basically better than the animal sources because they are lower on phosphorus and they are easier on the kidney when portion control. But again, I think what is the frequency, how much should be your per meal portion size, I'll just discuss in the future slides. And then talking about animal protein, I think egg whites are excellent quality proteins, but how much and how frequent is the important question here. And then lean meats, chicken, fish in moderation. And milk and curd, yes, it's a very good source of protein. For calcium also you can look into it, but at the same time they are high on phosphorus. In case you have higher phosphorus levels, again I think knowing your portion size for the milk and milk products is very essential. Paneer occasional in small amounts, because I think when you buy ready paneers you have to look into the preservatives available too. So that's the reason homemade paneers modifications are very essential again in this stage. Again, non-vegetarian options can be included in controlled portions based on your kidney function stage and nutritional needs. Egg whites and lean meats are valuable protein sources when monitored by your healthcare team. Then talking about how do you portion size for your Indian meals. Okay, so probably I think in a meal, whenever you talk about a plate, okay, meal plate, breakfast or lunch or dinner, okay, we are going to have three combinations. That is the grain source, then you have the protein, and then the vegetable source. But what is important is again the type of grain that you will have and what should be your portion size. Here it does not mean that you're going to be low on protein so you can take excess of carbohydrates, the grain source. No, you have to be very watchful on your grain source again. In case you are on corticosteroids, I'll further talk about those slides. Okay, so if in case you are on the corticosteroids or meal replacements, okay, so your carbohydrate availability going high, again it will add on to your variation in your blood sugar levels. At the same time it will add on to your weight gain also. Again, weight gain will be a burden to you itself. So that's the reason managing your grain source on the portion size is very important. And again, choosing the type of grain based on your potassium level. In case you're having very high potassium levels, probably then you have to restrict grains like ragi and certain types of millets to oats to certain extent, okay, because the potassium availability being high. The best choice at all times, considering the potassium level being low, is in rice, then jowar and bajra. These are your best choices. And then dals or lentils, half cup cooked dal, okay, which will give you around, which will be around 30 to 40 grams of protein. It is not the the protein availability. Here it is mentioning about the portion size, 30 to 40 grams of dal, okay, which is equal to half a cup of dal. Soak the dal overnight so that the phosphorus availability reduces generally before cooking. Then when you're choosing animal sources, either it can be one egg white or it can be 25 to 30 grams of lean meat or 30 grams of paneer per serving. Distribute protein evenly across all your meals. Okay, then talking about vegetables, again 1 cup cooked vegetable or 2 cups of salad. Limit vegetables which are high on potassium, vegetables like spinach and banana flower. Again, so the moment you are landing with a kidney challenges, it doesn't mean that you will start leaching the vegetables or you will start avoiding all the potassium rich vegetables. Again, we have the potassium content of the vegetables in 3 groups. So here depending on your potassium availability, we'll have to go on the restriction of which vegetables are good and which vegetables are not good. General in group 3 you have the vegetables from the green leafy and you have from the roots and tubers. Generally those are not recommended when you have higher potassium values, and in this stage you will be requiring leaching also. If your potassium is within the normal limits, obviously you can take all the kinds of vegetables but in moderation. Then very important, along with your macronutrients, you have to look into your micronutrient availabilities, that is your vitamins, minerals and all those things. For those, I think it is very important that we consume our vegetables, fruits and milk and curd, nuts and seeds, everything. But how do we kind of distribute, because these are at the same time good sources of proteins too. So it's important, and phosphorus availability is very high on dairy products. So how do we kind of distribute them is what is essential. So milk and curd, limit to 1 cup daily. Choose low fat options. Curd provides probiotics but monitor portion due to phosphorus availability. Then talking about paneer and nuts, 30 to 40 gram per serving. Nuts 5 to 6 almonds or 1 walnut weekly. Seeds 1 teaspoon weekly due to high phosphorus. Again, I think customizing is very essential. Here in generic way, I am talking about a diet which is going to be kidney friendly, okay, for the person with lupus nephritis and vasculitis who has a kidney concern. Then talking about fruits, I think the best choice of fruits that can be included on a daily basis are apple, papaya, pear and guava preferred, as the potassium availability is lower on this. And then limit banana, orange and melon 1 to 2 servings daily. Portion control again is very essential depending on the other comorbidities that you have. Then talking about vegetables, again pointed gourds are the best choice of vegetables. Cucumber, bottle gourd, cabbage, cauliflower. Limit spinach, amaranth and colocasia, that is basically the green leafy vegetables, and the root vegetables because they are high on potassium levels. Then talking about spices, fresh herbs are liberally can be used, okay, talking about like the mint leaves and all those things as seasoning or flavoring agents, but not like I think in form of chutneys. Again, you have to look into the potassium availability. For flavoring in small serving is absolutely fine. Limit on dried spices and avoid rock salt. Use turmeric, cumin and coriander and fenugreek safely. That does not harm you in any ways. Okay, and then talking about beverages, salt and fluids. Why it's important that we look into this aspect also. Basically, I think sometimes you are avoided with the fluid overload as well. So in case you are advised for a fluid restriction, and you will be on certain medications also if you have the comorbid conditions like diuretics and all those things. So it's very important that if you take a lot of beverage, coffee and tea, too many servings, it brings in a lot of dehydration, and at the same time there can excess caffeine increases your blood pressure levels also, and which in turn puts a lot of stress on your kidneys. So it's very important that you limit to just 1 to 2 cups daily. Again, it does not, the serving size in the cup is very essential, not more than 100 to 150 ml of coffee or tea as a beverage in a day. Herbal teas like green tea in moderation may be acceptable, but this has to be balancing on your fluid availability again. Talking about sugar, I think using all alternative sugars like the artificial sweeteners. Again, it's going to be a strict no to people with diabetes and kidney concerns. So it's very important that you be totally on sugarless things. Those who do not have the concern of diabetes, to certain extent they can use dates as a better alternative only if your potassium levels and the phosphorus levels are within the normal range. Again, go for the customized suggestions for your serving on sugar. It's very important. Then talking about salt, it's generally just not more than 2 to 3 grams daily. When talk about 2 to 3 grams, it's just going to be half a teaspoon to 3/4 teaspoon. And avoid table salt, pickles, papads and processed foods. Use herbs and lemon for flavor. Monitor blood pressure closely. And then talking about fluids, follow your doctor's guidance based on urine output and swelling. Typically 1 to 1.5 liters daily unless restricted. Track daily fluid intake including soups and beverages. It's just not the plain water. Whatever in the liquid form you take, all that counts for your fluid availability. Then this is just a typical daily meal pattern, I think, for a day, how you need to manage, okay, a practical approach, so that you know you're easily aware like how to balance your protein. So for example, early morning, here you can see a drink, okay, so a green tea, okay, followed by a serving of nuts, 2 to 3 soaked almonds and 1 walnut, and because of which you will be getting around 5 to 6 grams of protein. And then talking about your breakfast, you have an egg white omelette. Sorry, it's an yolk with a yolk omelette, but I think generally we recommend just an egg white, or around 20 grams of protein, or a lean meat of 100 grams, either one of them. And either it's going to be 2 cups of rice or 1 cup of anything in the cup measure, like a upma or a khichdi or a pongal. That should be just 1 cup of it. And over your lunch you will be having either 1 cup of rice or 2 rotis, and it's going to be either a dal or a lean meat or a fish, any 1 serving of protein source, and at least 1 serving of your vegetable in the cooked form, and 1 serving in the form of a salad. And I think cucumber is the only option that you can include as a salad. Again, it depends on the fluid availability, fluid overload. In case you have a lot of fluid retention, I think the salad consumption again has to be customized there. Talking about evening, the best choice would be, I think, fruit rather than taking any other beverages. But as an alternative, either you can have the fruit or the tea here, depending on your habits. And then talking about dinner, similar to lunch with smaller portions, but generally before 8 p.m. is always good, which eases your digestion and keeps your sleep better. And then distribute protein evenly, control your sodium and phosphorus, monitor your fluid intake, and take medications as prescribed. Regular follow-up with your nephrologist and dietitian and your treating doctor is essential for adjusting your meal plan and your medications. And the other important thing that I would want to add on here is, we always have to look into the drug nutrient interaction also whenever it comes to food. Okay, understanding how certain medications interact with food and nutrients is vital for managing kidney disease. These interactions can affect the drug absorption, effectiveness, and also lead to your adverse side effects. Probably you might be taking a lot of medicines, but I think if the wrong combination of food is taken at that point of time, the absorption of the medicine is hindered. So it's very important that you have to distribute the intake of that particular food to a different time when you are on certain types of medication. For talking about corticosteroids, they can cause sodium retention and potassium loss. So monitoring your salt intake and ensuring adequate potassium from low potassium fruits and vegetables is very essential. That's the reason I said, the moment you are having a kidney concern, it does not mean that totally you will stop eating everything. I don't eat salt at all, I have stopped taking salt, I don't eat protein at all. So then from where are you going to get your energy? Even for your medicine to act better, it is very important that you take the right kind of combination food and know your portion size and your serving that is required. Then talking about, even in case you are on immunosuppressants, grapefruit is a contraindication, and because it significantly alters the metabolism and it kind of leads to increased drug levels also. So it's better you avoid completely the grapefruit choice whenever you are on immunosuppressants. And in case you are on anticoagulants, that is like warfarin, one of the medication, it's very important that you distribute your vitamin K availability in the meal. It does not show that it is not necessary that you have to completely avoid all the green leafy vegetables just because you're on anticoagulants, but it is very important that when do you take these vitamin K rich foods. Only thing is you have to keep it 6 hours away from your medication to the vitamin K rich sources. Again, customizing your meal plan is very important based on when the doctor has suggested you to take the particular anticoagulant. And then talking about phosphate binders, and it has to be always taken with the meals to be effective, because they bind to dietary phosphorus, preventing its absorption. Missing a dose with food renders its ineffectiveness. So it's generally recommended with your food. Always, again, I am repeating the sentence at every slide. The simple reason is it's just a generic information, with reference to kidney function, kidney problems, how you need to manage. But always you have to go for a customized meal plan, and this does not mean that you will be including things the way it's being suggested here, but getting it customized from your dietitian and the treating doctor is very, very essential. This is a very important slide. Okay, you might be following everything, but these are your, I think, foods generally we are attracted to. Okay, because it kind of gives a good taste, as a better satisfaction. But I think in with lupus nephritis and vasculitis, I would say better stop, avoid these kind of foods completely. When we talk about processed and ready to eat foods, they are very high in sodium, and there are a lot of unhealthy fats, that is the trans fats, and there's a lot of preservatives too. This can increase your blood pressure, fluid retention, and inflammation, and it is all detrimental to kidney function. Probably, like, see, I've heard people like saying that, okay, I just had like 1 tablespoon of a mixture. Do you think that will matter? But I think the amount of salt that will be available in 1 tablespoon of mixture or one single papad, okay, probably it could be just like around 2 grams of salt. But your intake for a salt is just 3 grams through the day. So by just taking that, okay, you have kind of hindered your body's metabolism. But since you're already on a compromised stage, okay, in case you include these kind of unhealthy options, you will be kind of putting a lot of stress on your own body, and I think you will be landing up into like, I think, fluid retention, breathing difficulty, inflammations, okay, blood pressure variations. So that's the reason it's better you say no to such kind of foods. Then again, talking about sugar and packaged drinks, often they are loaded with sugar and artificial ingredients. Sugary drinks contribute to weight gain and can worsen blood sugar control. Some colas also contain high phosphorus levels, so that's the reason it's better to say a no to this. Then talking about refined grains and carbs, basically it suppresses your immunity totally and it adds on to your empty calories unnecessarily. So it's important that we completely stop them, and in case you are a diabetic, there will be a rapid variation in your blood sugar levels, and it also contributes to a lot of inflammation and metabolic stress. So it's a complete no when it comes to refined grains. Again, talking about red meat and high sodium salts, they are high in saturated fats and phosphorus. Red meat can increase inflammation and kidney workload. All sodium salts contribute to fluid retention and elevated blood pressure. So with this reason, I would say a complete no to red meat and high sodium salts. And in case, okay, unavoidable circumstances, you happen to pick ready to eat foods, okay, reading the labels is very, very essential. Pay close attention to the ingredient list and nutrition facts for hidden sodium, phosphorus, and sugar, even in products that seem healthy. So I think that's very important whenever you pick any ready to eat products. A simple hint I want to give here is probably sugar. Okay, we all know sugar as just sugar, but sugar has almost 81 names. Some of them are like dextrose, maltose, palm sugar, cane sugar. So probably you will just look into the name of, like, I think, sugar or glucose, but maybe if it is named as maltose or dextrose, okay, or a sucrose, you might be thinking that there's no sugar, but that is also a form of sugar. So this is one of the hint that I'm adding. Okay, so that way, whenever you're kind of buying anything ready to eat, read into the label and think 100 times before you're consuming them. Home food is the best choice whenever you are having multiple complications on your health. Okay, so this was my simple input for the being the World Kidney Day, okay, on 12th March. I just wanted to add on this generic information, okay, with reference to lupus nephritis and vasculitis. If you require further, okay, individualized consultation, do contact us at this given numbers, and do kind of look into our website for all the details, which will kind of let you know about our services that we are offering here. Thank you.
Don't have any questions right now.
No questions.
Yeah.
Okay. So should we stay on the call, or how is it? Should we stay, or we'll leave the call?
We can close the session.
We can close the call now.
Yes, yes.
So I'll leave it. Okay.
Yes.
Thank you. Thanks a lot.